Bill attempts to address the practice often referred to as step therapy or fail first. Step therapy policies are commonly used by health plans and health insurers to control health care costs while requiring enrollees to try various medication and or treatments before giving the enrollee access to the medication initially prescribed by the doctor. When health care insurers refuse to cover a medication prescribed by a patient's doctor, oftentimes they're switching them to a drug that has a completely different molecular structure. For example, patients experiencing diabetic pain might be given a prescription for Lycra by their prescription. However, insurers might tell them to try the painkiller Advil or Tylenol, or they might put them on Prozac. Prozac is an antidepressant, not for patients experiencing diabetic pain. Another example might be when treating gastric ulcers. A physician might prescribe Frotenex, but insurers might instead require patients to fail first with a more general Prilosec. There's nothing wrong with switching pain patients to a different generic medication that has the same molecular structure and has been approved for their particular condition. But the problem occurs when the drug has a different molecular structure. As a matter of public policy, we cannot afford to have health insurance executives deciding which medication patients should be allowed to receive for the management of their pain. Those decisions are best left to the medical professionals who are in a better position to treat the patient. AB 1144 would bring California one step closer to changing practices that have resulted in higher health care costs, wasted hours spent by physicians, and patients being denied the best treatment possible for their condition. Too many Californians are suffering unbearable pain and should not be forced to experience prolonged suffering. I respectfully ask for your aye vote. Here today in support of this bill are Cynthia Toussaint, the founder of For Grace, the bill's sponsor, and Scott Fishman and Loretta Fishman.
Thank you very much and welcome. Go ahead and please, if the first of those two witnesses could go ahead and identify themselves and speak into the mic in front of them.
No.
Thanks, okay.
Yeah, but you go first.
Good afternoon. My name is Scott Fishman. I'm a physician in support of this bill. I'm speaking on my own behalf, but I serve as the chief of the Division of Pain Medicine at the University of California, Davis, professor of anesthesiology. I'm also the past president of the American Academy of Pain Medicine, which represents pain medicine in the House of Delegates of the AMA, and I'm also president of the American Pain Foundation, which is the largest consumer advocacy group for patients in pain. And I'm appreciate your time. I will be very brief in supporting this bill, which is very important. It's important because, as the House member clearly said, the practice of insurance companies in requiring step therapy or fail first therapy takes medical decision making away from those who we entrust and make responsible for such decisions. And I can tell you on a daily basis, I spend hours with insurance companies fighting because I can't get the medicine that I need to get for my patient, because instead they're required to try a different medication or fail that medication first, despite the fact that that medication may have a lower yield of working and may be less safe. And what I'd like you to consider is that the number of people with chronic pain actually outnumbers those with diabetes, heart disease, and cancer combined. It's a huge population out there whom, when we allow them to fail, we induce cost. There's enormous cost in allowing these patients to spin, ramp up their pain. They're enormous resource utilizers, which is what the scientific literature tells us. And again, you know, the cost in savings may be measurable. The cost in suffering here is immeasurable. I'm on the front line of this. My groups, the American Academy of Pain Medicine, the American Pain Foundation, have all opposed this, and I know other major medical groups have opposed this as well for the reasons I stated, and I have supported this bill, and they have opposed the practice, and I urge you to support the bill as well. Thank you.
Thank you. Next witness.
Thank you. My name is Cynthia Toussaint, and I am a living example of the terribly botched healthcare system we have in this state. Over 26 years ago, I was a 21-year-old ballerina with a very bright future when a minor ballet injury triggered the chronic pain disease known as CRPS, or CRIPS, in my right leg. For the first 13 and a half years of my illness, all of my HMO physicians told me that my problems were all in my head. As a result of that abuse, I spent nearly a decade of my life bedridden, and for 5 of those years I was not able to speak while the CRIPS spread throughout my entire body and ravaged my vocal cords. To make matters worse, a decade ago I developed fibromyalgia as an overlapping disease, so I now not only deal with constant pain, but I also deal with constant fatigue. And if you think about it, how do we torture a human being? Well, we give them physical pain and we deprive them of sleep. Welcome to my world and the world of many of my sisters. Today I am founder and spokesperson of For Grace, where we ensure the ethical and equal treatment of all women in pain, and it is on behalf of that community that I am speaking. Over the past 26 years, I have faced countless barriers to health care, including Fail First, which is a disaster for me and for all women in pain. Fail First must have pulled a page from the HMO playbook because its business plan is identical. Simply put, it is profit over patient care, and that unethical delay in treatment, just like my HMO nightmare, causes unnecessary harm and suffering and ultimately turns many of us women in pain into lifelong sufferers. Fail First is good business for the insurance companies as it is lining their pockets, but please make no mistake, Fail First is bad medicine for all women in pain who, like myself, depend on the right medication at the right time. I support AB 1144, and I ask on behalf of the 4 million women in pain in California, including myself, that you please vote yes on AB 1144 today so that we can move this bill onto the governor's desk, get his signature, and together begin saving women's lives. Thank you so very much in advance for your great support.
Thank you.